I'm Dr. Sanjay Pandey, consultant urologist at the Kokilaben Dhirubhai Ambani Hospital in Mumbai. Friends, in andrology in men's health, one topic which is so important is called varicocele. And varicocele has been missed out, or varicocele has been actually blown out of proportion, and one needs to discuss few important points in varicocele. In other words, men have got testis which hangs in the scrotum, and two testes are normally hanging in. If somebody has got one testis hanging, the other one perhaps has developed and is stayed inside, because these testes develop, come down into the scrotum on the day of the birth. So when the testis hangs in the scrotum, and as we mature and as the hormone changes around and scrotum develops, changes which bring about organizational changes in the scrotum is one called varicocele. Varicocele is all about dilatation and tortuosity of these veins, which actually drain the scrotal contents or the testicular contents back. A testicular artery brings blood to the testis and the veins take it away. These veins, not one but few, is called a Pampiniform plexus of veins. Now these veins all contribute to drainage back into the system. Now what happens in men? Because men are people with 2 feet around compared to animals who are on 4 feet. When we stand, we always have a kind of a scrotal drag or a content issue which is not visible and which is not a disease. But there are men who could have valvular defects happening more commonly on the left than on the right, and therefore you find that there could be a swelling in the testis, which not necessarily is a hydrocele. Hydrocele is a watery collection within the tunica vaginalis, and therefore you find a tense kind of a situation where one big ball has developed in the scrotum as a hydrocele, water content or collected. But varicocele is about tortuosity in those veins which actually drain by the Pampiniform plexus and get lesser and lesser veins as they go back into the retroperitoneum. So what happens to men and why do they come to us, and what is the discomfort? Men may complain of pain in the scrotum. So a lot of times, scrotum being a very sensitive area, including testis being equally sensitive area, there could be discomfort. Discomfort or a pain because of infection, because of inflammation, because of some kind of a drag, or because of neuralgia per se, which is called as orcalgia, a nerve-related issue. An andrologist is important to be looking into these aspects of care and looking at which is the cause. For example, somebody comes with a severe pain in the scrotum or the testis of 1 day, 1 week duration, and he has got swelling and fever. Then he probably has got epididymitis, epidermolysis. Somebody has got a dragging sensation in the scrotum for months together, especially more in the evening and night, because he's walking, he's either a tailor or a rickshaw puller, he's either a man who stands in front of a camera for a long time and contributes to entertainment and to health and to awareness. He could be having a scrotal drag because of long hours of issues in his scrotum. What happens is a development of a varicocele. Varicocele could happen completely idiopathically. That means there may be no cause. It could be male-related phenomena where the veins are becoming tortuous. So if I pick up 10 people from the street, 3 to 6 people could be having varicocele of some grade. It could either be a grade 1 or a grade 2 or a grade 3. Is that a bother or not a bother? They would say, I don't have a complaint. Why should I see an andrologist or a urologist? In other words, varicocele can be a phenomena which could be completely asymptomatic and could be picked up when we do a Doppler sonography of the scrotum for some reason. For a pain in the testis, for a drag in the testis, for an evaluation of the scrotum. If a sonography is done and we pick up a varicocele, then we get anxious about it. We've got a varicocele. What will be the effect of it? So effect of varicocele could be on the testis, one or both sides. In other words, it probably would be increasing the temperature and the toxicity of that zone by not draining the blood out. So blood pools there, the veins are more tortuous and more amount of veins get dilated. So your anxiety is about you feel, you touch, you find the scrotum a little bit bag of worms, your andrologist examines you and finds that there is a clinically significant varicocele. So varicocele, when to treat, whom to treat is a very important aspect. In other words, number 1, if it's a painful varicocele, if you've got discomfort and pain, it is a drag, the varicocele is significantly grade 2 to grade 3 and it's giving you a lot of discomfort. Attempts have been made medically to treat you, to take away the neuralgic component, you still have got discomfort. So painful, uncomfortable, discomforting, significant varicocele undergoes a varicocelectomy. The other more important aspect of varicocele treatment and repair is men undergo varicocelectomy in their prime of life for infertility. So a common surgical correction which could bring about fertility changes about the semen analysis is brought about by varicocelectomy. A treatment may be quite indirect. In other words, a urologist or an andrologist does a varicocelectomy. That means we at Kokilaben Hospital would do a microscopic varicocelectomy by a subinguinal route. We also use an intraoperative Doppler to identify the veins, nerves, veins and the lymphatics and the arteries. And when you look at that, we only want to tie the veins, not the arteries. So there could be one or two arteries which you want to safeguard for the testicular function and capability to continue. So veins that we tie brings about a change in the reversal of the entire aspect, which is actually happening around. With Valsalva's maneuver, reverse flow happening around, lot of blood pooling in the scrotum, giving you discomfort, giving you swelling, giving you a testicular atrophy or the testis gradually going down in its size as a result of chronic temperature changes and chronic changes happening around, can be reversed to some point by doing a timely varicocelectomy. But sadly, varicocelectomy unfortunately is so commonplace. Any and everybody is undergoing a varicocelectomy just because we picked up something which is a varicocele on an ultrasound. So one needs to judge an imaging investigation with the patient's requirement. Not necessarily that all the reports need to be treated. So as a doctor, many times I would order an investigation and look at the investigation. Many times a patient would carry ultrasound reports for the last 3, 5, 7 years. So our job is to wake up to a phenomenon. Who needs a varicocelectomy? So for infertility, where there is oligosteroteratozoospermia, individuals who have got a significant varicocele which is bringing about testicular atrophy, individuals who could be even young and could even be beyond adolescence with large varicoceles which could probably give them a lot of incapability in terms of testicular atrophy, which could give them pain and discomfort which is isolated and continued around. We won't keep watching, we will treat them. So varicocelectomy has its own indications which a doctor decides looking at the aspect of his health, changing health, the discomfort, the changes in the semen parameters, all those have to be looked at. So friends, it's an awareness attempt today to look into men who have got discomfort in the scrotum, orcalgia or pain in the scrotum which could happen to many men. Not necessarily all of them are varicoceles. A Doppler sonography gives us some idea. Examination gives us all the idea. Talking to a patient, understanding the bothersome gives a lot of idea. And therefore, many of these consults may not be online consults. We need to examine patients. For genital problem, many online consults don't really work. I mean, we could always be friends, could understand, but at the same time, we need to examine them and re-examine them. Revisit the entire aspect which has been treated in the past to take it forward on the journey where he on one side is not bothered, his treatment is done, he's safe, and that's the way it works forward for genital problems or for andrology. So in andrology, aspects of care many a times is missed out or many a times are serious emergencies. This emergency needs to be prevented. Some people undergo a varicocele surgery by different routes that they undergo, inguinal route and scrotal route. Many of them undergo angioembolization of the veins around, which is a different aspect of care that we don't discuss as urologists, where we look at ablating these veins. We look forward to getting the gold standard and getting a standard of care, which is a varicocelectomy and microscopic varicocelectomy of the subinguinal route with an intraoperative aided Doppler actually happens to be the standard of care, which probably could take it to the next level. So these are all awareness attempts to take you forward in the journey where men's health is missed out. Men's health is so much into domain of anxiety, and many a times, obviously, two doctors would treat you differently. At two different points in time, you could be two different patients. You had a varicocele surgery done, varicocele can also recur. There's a recurrence rates happens around because other veins can develop and on collaterals. So a lot depends on your follow-up, and during the varicocelectomy and after the varicocelectomy, have we achieved what you wanted to achieve? What was the problem? Was it orcalgia and pain because of varicocele? Was it an infertility issue with oligosteroteratozoospermia? So it's an indirect treatment to something by tying the veins, by doing a varicocelectomy, you're actually giving them a result and a reprieve of troubles which actually is going through. So varicocele is common. Varicocele is more common on the left. There could be some varicoceles which actually would not disappear when you lie down. So standing, you have a larger varicocele, you lie down, the varicocele disappears. Very classically, is a phenomenon of idiopathic varicoceles, more valve-related issues, and related issues gradually progress. There can sometimes be a left side varicocele where you could be having a renal mass or a tumor involving the vessels, and therefore the varicocele cannot disappear. So non-disappearing varicocele many a times will have to be evaluated that there is no renal tumor. In other words, we need to look at a clinical examination rather than looking at very theoretically. The aspect of care lies completely with the patient and the andrologist who sees him. Therefore, be aware that this is a very important aspect of andrology, just not to undergo surgery in all the patients. Those who undergo surgery, the results are this. Those who undergo surgery, if they have a recurrence, the treatment is available. So we got to look into the discomfort, pain, agony that a man goes through on one or both testes. And not all pain in the testes is varicocele. Very important. That means you have got pain in the testes, you picked up a grade 1 or a grade 2 varicocele, you undergo a surgery, your results did not come, you did not get relief, is a very important aspect of it. So we need to first identify what is the cause of orcalgia, what is the cause of pain in the testes, one side or both sides, testicular pain which is radiating to the thighs, radiating to the inguinal region, radiating elsewhere, comes intermittently, are aspects that we need to know. So friends, it is important for us to identify, know what is varicocele, and take it forward logically by your doctor, who will probably treat it and cure you of the condition that you're going through. Varicocele awareness is a requirement rather than jumping into a surgery immediately. But if there's an indication, we treat and probably get you sorted out. Thank you so much.